Hello and welcome. Thank you for listening to my presentation for the PIDP course 3240. For the next 7 minutes, I will be talking about how cancer imaging works and some of the facets of cancer research. By the end of this presentation, I hope you will gain a general understanding of how cancer imaging operates and get some exposure on the complexities of fighting cancer. Cancer is the uncontrolled growth of cells. These cells can grow bigger and interfere with the function of nearby healthy cells. This is especially worrisome for tumors that are found in the vital organs. If the cells burst, they can become malignant and affect more than its immediate surrounding. This can be worsened if it spreads to other parts of the body via cardiovascular system. There are over 100 types of cancer that affects humans alone. It is estimated that 14 million people are affected by cancer in the United States, and 200,000 new cases appear every year. Approximately every 2 out of 5 Canadians will develop a form of cancer over their lifetime. Unfortunately, there is a high chance that someone you know will have developed a form of cancer. Now, there are many factors that can cause cancer on top of genetics and lifestyle habits. There are preventative measures that we can do, including changing our diet, but this is still in its infancy. Cancer is prevalent, and we need to find cures and address the current epidemic. We must have a way to visualize cancer cells and tumors before we can start delivering anti-cancer drugs and radiotherapy. There are 2 strategies we can consider. 1, because cancer is a cluster of rapidly growing cells, this means that they can use a lot more resources and eat up a lot more sugar than nearby healthy cells. 2, because these cells are bigger than normal cells, they have more receptors on the surface, and some forms of cancer have unique receptors. So how does this help us? Well, most imaging techniques involve some radioactive material. If we make sugar radioactive and have our patient consume it, most of the sugar will go to the tumor. We can set up equipment that measures radioactivity levels and triangulate its position and size. Although not without its challenges, this is the most common way to image cancer currently. Next, we can use the overexpressed receptors to our advantage. These receptors can be found on the surface of these cells and behave similarly to that of a lock and key. If we are able to figure out what type of key the receptor needs, we can make it radioactive and visualize it the same way. But we have to be careful what type of radioactivity we use. There is more than one type of radiation, and depending on how we use it, we can divide our imaging techniques into 3: PET scans, CAT scans, or MRI, all of which operate under different principles and provide us with different information and different challenges, as well as their unique advantages, all while giving us live images of cancer in the body. MRIs, for example, work under magnetic resonance and work on the patient being exposed to strong magnetic fields. A patient undergoing an MRI scan will have a full scan of the body or head after drinking a contrast reagent. The images depicted are full scans of the surrounding tissue and can give a lot of extra information. Patients with metal implants cannot undergo an MRI scan. Although MRI provides us with a lot of information, the cost to operate and maintain these equipment are often very high. Since these work on very strong magnetic fields, superconductors, and liquid helium, the acquisition time can often be very long, which translates in longer waiting times for patients. And there are also strict guidelines imposed on the patient's diet. CAT scans, on the other hand, operate on high-energy X-rays, and these can provide specific information about the tumor. The patient will be required to drink a contrast liquid and then submit it to X-rays that can pinpoint the specific tumors in the body. This method is a combination of the 2 strategies I mentioned a few slides back. CAT scans work similarly to MRIs and can provide very detailed information, but are limited with the amount of X-ray exposure and the clearance of the contrasting liquid. Although typical contrast reagents are non-toxic and hypoallergenic, patients are usually given a larger amount of contrast liquid. The refractory period depends highly on the amount of contrast reagent consumed, and this can often take some time. However, PET scans work a little differently than the last 2 methods. The machine around you is not hitting you with any levels of radiation or magnetic fields, and is only there to pick up the signals emitted from the radioactive tracer that was injected. Tracers are a small amount of receptor-specific molecules that emit low levels of beta radiation. There are many research groups that are dedicated in developing new tracers. There are many advantages to using different types of tracers. A tracer that provides a high resolution with using lower amounts could mean that one batch could be applied to more patients, thereby improving the cost efficiency of PET imaging. Many more tracers exist that use unique receptors within tumors and can use gamma or alpha radiation. Although the 3 different types of imaging techniques can be used as standalone methods, it is often used in combination to retrieve very high-quality images. Early detection is important because tumors can become malignant at some point down the road and spread to other parts of the body. This is an important step in fighting cancer, as knowing is half the battle. The typical sugar PET imaging works on the premise that cancer consumes more sugar than other cells, but this may not necessarily be the case with tumors. Some of them will be very small and be very difficult to differentiate between healthy and cancerous. Contrast reagents are general and may not be enough for all forms of cancer. Meanwhile, the number of PET tracers are increasing, with some being developed that is specific to one form of cancer. There are also problems with dosage and imaging, where with low dosage comes lower radioactivity and a low resolution. Increasing resolution will require more material, which increases the radiation and can sometimes lower the contrast. This problem is similar to a camera, where if we focus one thing, we might throw off another. It is important that researchers find a balance in cancer imaging. Because cancer is a global issue and millions of lives are affected, there is an increased pressure on the research to give not only good images, but also effective therapies. There is very little harm when we are exposed to magnetic fields, X-rays, or positrons. I hope this presentation did not scare you about radiation. In truth, repeated exposure to these techniques is still safer than letting the disease run its course. The main concern, however, is the availability for these techniques. These are far and few from hospitals and are spread far apart in North America. The real scary part is not having one available for those that need early detection, and some hospitals may only have one type of imaging nearby. These are often flocked with patient lineups as well. With large estimates of cancer cases, urgency and availability becomes an issue. And as we reach the end of this presentation, I hope you have now an appreciation for cancer imaging. I also hope now that you are aware of the technology we use and can start thinking about some of the challenges we face when fighting and imaging cancer. This brings me to the end of my presentation. I hope you had an educational experience, and I want to thank you for listening to me for the last 7 minutes.